Good afternoon. This is Kate from the Midwestern Public Health Training Center. Before we get started, I have a couple logistics I wanted to go over with all of you. There will be a question and answer session at the end of the webinar. You can ask questions at any time by using the Q&A function on your screen, which looks like a box with a Q in it. You can also use the chat function for questions, comments, or to share resources. The chat function looks like a talking bubble with an ellipse in it. You should see a message pop up right now. The last thing was that we will be recording and archiving this webinar, so you will receive a message about a week after the webinar with the link to the archive. That's all I have, so I'm going to pass things over to Deb.
Hello, welcome everyone to this webinar for community health workers. Our focus today is on depression. I'm Deb Kazmierzak and I'm with the Iowa Chronic Care Consortium, which is a nonprofit organization dedicated to advancing the skills of the healthcare community to reduce the burden of chronic disease and advance the health of populations. Today I'm pleased to introduce the final of 4 webinars for community health workers that aims to provide information about various health topics. The goal is to arm webinar participants with some basic information about specific health conditions so that you're able to serve those clients or patients you work with more effectively. Frontline community health workers are uniquely positioned to provide supports and link patients with services when they need them the most. Having a basic knowledge about health conditions can help you be more effective in your role. We have partnered with the Midwestern Public Health Training Center, housed within the University of Iowa, to bring you these webinars, and we want to thank them for their partnership on this work. Depression is something that is often misdiagnosed or sometimes missed altogether. Depression manifests itself in a number of ways, which our speaker will tell you more about. Adding to that, we know that healthcare is changing, and given what we know about the social determinants of health, healthcare provider shortages, including mental health providers, and changing reimbursement structures, increasingly we are thinking differently about the provision of mental health services and supports. We need to approach depression or other mental health issues from different perspectives and in different ways. And we believe community health workers can play a key supportive role. As I mentioned, there were 3 additional webinars that have been archived and are available, focusing on opioid misuse and addiction, obesity, and diabetes. And I invite you to check those out if you were able to participate in those webinars. Today's webinar presenter is Molly Lee, who also provided the webinar on obesity. In her day job as a public health veterinarian, Dr. Lee works at the interface of animal and human health, promoting a safe and secure food supply and healthy human-animal interactions through developing educational materials for veterinarians, livestock producers, and the public. Dr. Lee has enthusiastically used her considerable skills, along with the additional skills she picked up through her Master of Public Health program at the University of Iowa, in a new context by developing these materials for community health workers. She's done a great job in condensing this material, and I think you'll all learn something new today. With that, I'm ready to turn over the reins. Molly, take it away. Molly, are you there?
Can you hear me?
Yes, now we can.
Okay. I was talking away and didn't realize nobody could hear me. Thanks so much, Deb, for that introduction. I am pleased that all of you are here today and excited to give this webinar on depression, a training for community health workers. And I did want to note before I kind of launch in that this was developed for community health workers in Iowa, but really all the information here is applicable to a broader audience. So if we have individuals from other states joining today, this should be really relevant to you as well. And again, recognizing the varied role of the community health worker, I know that some of these parts will probably be more applicable to certain people and others will find different parts of the presentation more relevant. And I know I can't hope to encompass all the responsibilities of the community health worker within this hour-long webinar, but I hope I can give you some key points and a place to start in helping your patients with depression. So the goals by the end of this webinar is to be able to explain what depression is as well as what it is not, explain the symptoms, causes, and common comorbidities of depression, and how depression is diagnosed and by whom. You will also be able to describe the impact of depression and the importance of understanding depression, and be able to apply this to your community and patients or clients. Finally, you'll be able to identify barriers to treatment of depression and tools to overcome these barriers. It's important to keep in mind as we go through this webinar that participation in this webinar, of course, doesn't make you a trained mental health worker. Rather, the purpose is to increase your general understanding of depression so that you're more effective in your supportive role to your patients or your clients and their families. So what is depression? According to the American Psychiatric Association, depression is defined as a common and serious medical illness that negatively affects how you feel, the way you think, and how you act. Depression causes feelings of sadness and/or a loss of interest in activities once enjoyed. It can lead to a variety of emotional and physical problems, and it can interfere with daily life and normal functioning. There are many different forms that depression may take, and these forms can vary in what symptoms the patient shows, how severe the symptoms are, and how long they last. Because depression can be so different in each person, it's important for you to help your client work with their primary care provider or a behavioral health care provider. And one way that you can do this is by helping your clients describe their symptoms or help them log them to give the provider more information that can lead to a diagnosis. A specific diagnosis is helpful in the most effective treatment of depression. So this can really be valuable when taking this information to the healthcare provider. The most common kind of depression is major depression. A provider will make a diagnosis of major depression if a patient has at least 5 of 9 specific symptoms, which the goal of the webinar today isn't to, for you to be able to diagnose major depression. And I'll go into the specific symptoms a little bit later, but for example, insomnia, significant weight or appetite changes, those are a couple of examples of symptoms that might be associated with major depression. And to make a diagnosis of major depression, the individual has to have had all of these symptoms for at least 2 weeks in a row. Another common kind of depression is called persistent depressive disorder or dysthymia. This is diagnosed if a patient has 2 or more of 6 specific symptoms. Many of these overlap with the symptoms of major depression, and another couple examples are feelings of hopelessness. And if the individual has had these symptoms most of the time over a period of 2 years, that's classified as persistent depressive disorder. The symptoms of persistent depressive disorder are generally milder than in major depression. So now we've gone over what depression is. What exactly is depression not? So mental health in general is not simple, and it can be really confusing for the patient and the healthcare team. It's important to understand that while other emotions and mental health disorders may sometimes appear like depression, seeing these things in individuals in your community does not always mean that they have depression. Likewise, if you see some symptoms of depression in a patient, that may not mean that they have a definite diagnosis of depression. So depression, as we will be discussing it today, is not the same as situational depression, which is sometimes called adjustment disorder. This is a temporary type of depression that a patient may experience after a traumatic event like ending a romantic relationship or losing a job. Grief or bereavement, which is a normal reaction to losing something or someone a person loves, is another type of situational depression, and that's a normal reaction. There are also many other types of depressive or psychological disorders that are diagnosed and treated in specific ways, and you'll see some of these listed on the screen here. Some examples include bipolar disorder, seasonal affective disorder or SAD, psychosis, postpartum depression, anxiety disorders, addictive disorders, eating disorders, personality disorders, and others. these other disorders, while different than major depression or persistent depressive disorder, may be a trigger for depression, or these conditions could occur at the same time. Depression may also be misdiagnosed as one of these health conditions, or vice versa. There's also a lot of overlap between risk factors and treatments among these disorders. And the community health worker is a really important part of helping the patient to understand both what depression is and what it's not, so that treatment of depression is as successful as possible. So kind of to recap, it's not simple, it can be confusing, and situational depression, grief, bereavement, things like that, these other disorders are still really important, of course, and have their own diagnostic and treatment nuances, but to kind of limit the focus today, we're going to be focusing on major depression and persistent depressive disorder. So the symptoms of depression can be many. An individual may have several of these symptoms or just a few. Some of the symptoms of depression include feeling sad, empty, or hopeless, having a decreased interest in activities, significant weight changes, including weight loss or weight gain, changes in sleep patterns, including trouble sleeping or sleeping too much, restlessness and agitation that is noticeable by others, tiredness, feeling worthless, having feelings of guilt and low self-esteem, trouble making decisions or trouble concentrating, and thoughts of death or suicide. So the symptoms of depression can also vary. If you work with young children or teenagers that have depression, you may notice other signs instead of or in addition to the signs that we just listed on the last slide. Children may perform poorly in school, they may have frequent nightmares, or they may be disobedient, aggressive, or have temper tantrums more often than expected. Teenagers may have signs such as being tardy often or absent, or perform poorly in school or during extracurricular activities. They may neglect their appearance, and they may also engage in self-harm such as cutting. You may notice withdrawal from friends and family as well. So what causes depression? Depression is not fully understood, even by those who study it. It may be helpful to think of depression as being caused by risk factors, though, in three main categories, which when combined become too much for the patient, resulting in depression. Risk factors may be biological, environmental and social, or psychological. Risk factors that have to do with the biological makeup of the person include genetics and family history, as well as gender and race. For example, females, African Americans, and Hispanics are at greater risk for depression. Depression is also more likely in some ages rather than others. Sometimes things that are a normal part of the human brain can also malfunction. For instance, amounts of different brain cells or imbalances in different brain chemicals. And you may have heard of some of these substances such as serotonin, norepinephrine, and dopamine. And then other medical conditions like a hormonal imbalance caused by something like hypothyroidism, or for example, a painful condition that causes problems sleeping, can also contribute to depression. It can be helpful for the patient to understand that most of the biological causes of depression are outside of their control. So encourage your patients and clients to not be ashamed of their depression, and look at it as the result of these biological causes, which manifests as depression, can still be successfully treated and managed. I did want to mention the image shown on this slide. This is a brain scan that compares brain activity during periods of depression, which you'll see on the left, with normal brain activity on the right. So there's that increase of blue and green colors and decreased white and yellow areas on the left side, and that shows decreased brain activity due to depression. So it's often very helpful to realize that there's a true biological component to depression. It's not all in the people's heads figuratively. It is actually literally a biological problem. So that can sometimes help with reducing stigmas and helping to increase the importance of treatment of this condition. The environment that a person lives and works in, as well as other social experiences, can also contribute to depression. If a person is experiencing adverse life events, such as violence, abuse, or neglect, they may be more likely to develop depression. And you guys may have heard of the ACE study, which has shown that if a person experienced adverse childhood experiences, that's what the acronym ACE stands for, they're also more likely to experience difficulty as an adult, and they're also at a greater risk of depression. Poverty is another significant risk factor, and the relationship between living in poverty as a child and continuing to live in poverty as an adult has also been shown by the ACE study. And that's especially hard to break, making depression more likely in these individuals. Other risk factors related to the physical or social environment or social determinants of health that a person lives in include stress, a lack of social support or loneliness, substance abuse or smoking, and certain cultural views or stigmas that make it difficult to acknowledge or deal with depression. Another risk factor for depression is a physiological shift in the person's motivational and emotional system. The way that depression is triggered physiologically can be understood by something we call behavioral shutdown. So this is when a risk factor, such as one of those biological, environmental, or social risk factors just mentioned, and anxiety and frustration due to this, blocks the person's ability to find a productive way forward. So when they're stuck in this way, the patient kind of tends to experience more negative emotions and fewer positive emotions, and their actions also tend to be more negative. Then when the person becomes aware of this block, they may focus on it and their past losses or problems with taking action. This in turn decreases their initiative to find a productive way forward. They lose energy, and so then they end up in this maladaptive cycle of behavioral shutdown. That's kind of a complicated concept. So to understand this example in real life terms, let's look at an example. So Maria is a 65-year-old Hispanic woman who just moved with her daughter and 2 young grandchildren to central Iowa from Mexico. Maria takes care of the grandkids during the day when their mom's at work and works nights to try to make ends meet. The children have just started school, and Maria would like to fill an opening in the day shift so she can spend more time with her grandkids after school, so that she's not always so tired, and so maybe she can make some friends. However, she has struggled to learn English, and she's afraid that if she works the day shift, more people will realize how little English she speaks. She feels so much pressure from this challenge that she's afraid she'll never be able to succeed and misses her English class. Later, she thinks back on skipping this class and gets angry with herself. She focuses on her failure and kind of believes that someone that has failed like she has in her mind will probably fail at a new job too, so she doesn't apply for the new job. Maria's thus stuck working the night shift. She's ashamed to return to English class, and she loses her initiative to try to make friends. So looking at this example, Maria has a few risk factors for depression already: her gender and race, a lack of sleep, struggling to make ends meet, and loneliness. Due to the frustration that she feels with herself on her struggles with learning English, she's also experiencing behavioral shutdown, which is blocking a way forward that would improve her quality of life. So this is a very real example that you could see in your community, and a definite contributor to depression. As a community health worker, you likely frequently work with clients with other chronic health conditions. You have a unique and important role in monitoring for signs of depression in these individuals, as well as all the patients and clients that you work with. But with these people with co-occurring chronic health conditions, the likelihood that they're also struggling with depression might be quite high. Some other disorders that have been specifically identified to commonly co-occur with depression include hormone disorders like diabetes, hyper or hypothyroidism, or Cushing's. Heart disease is another, and depression has been shown to possibly be even more likely to occur if the patient has had a heart attack or bypass surgery in the past. Depression may also be seen more often with diseases that cause chronic pain, for example, fibromyalgia or debilitating conditions like COPD. Having a stroke might also increase a person's risk for depression, and then a variety of other diseases and conditions. Alcoholism and drug abuse are also closely linked with depression, and some studies have shown that 1 in 3 people with major depression abuse drugs or alcohol. You may first notice possible depression in a person with chronic condition if they're having difficulty sticking to their treatment plan. That's kind of one light bulb moment that you may notice, and kind of increase your awareness of looking for depression in these people. Also keep in mind that depression can lighten up significantly, particularly when it's comorbid with chronic conditions, when the patients begin to feel that they've gained some control in the management of these other health conditions. So there are many possible members of the healthcare team that can help a person with depression. Getting an individual to seek help from their primary care physician, nurse practitioner, or physician's assistant is a really important first step for undiagnosed depression. And the provider can determine if and when other professionals are needed. These doctors might suggest a variety of treatments. They may also prescribe medication, or they may refer the person to a psychiatrist who's a physician specifically trained in mental health. Clinical psychologists and social workers are highly trained to work with people with mental health disorders, including depression, on specifically implementing behavior changes. So these members of the healthcare team, as well as counselors or therapists, tend to meet and talk with the patient on a regular basis as a part of their treatment. I did also want to note that sometimes a person may visit an emergency room for a reason related or unrelated to depression, and they may be diagnosed with depression or more likely advised to be screened for depression by an emergency room physician at that time. And it's important to try to get the patient out of that emergency room treatment method for their depression. And as a community health worker, you can really help them by encouraging them to seek a more sustainable route of healthcare by visiting their primary care provider if you become aware of this. So as you can see, the community health worker is right there in the middle of the healthcare team, and you're really valuable and important to these patients with depression. Navigating the mental health care system can be even more complicated than the general healthcare system and confusing to patients and clients. So you can really serve an important role as the patient's advocate, a connection to other supportive services, and someone who can just help with kind of the practical aspects of their life as it relates to their healthcare. So what do you do if you suspect depression in a client or community member that you're responsible for? If you're able to encourage them to seek care for possible depression, the first step will be arriving at a definite and specific diagnosis. As I had mentioned a few slides ago, there's a lot of different ways that mental health can manifest, and as well as mental illness. And so diagnosing depression specifically is usually done through a screening test where the patient answers a series of questions. As a community health worker, being available for your client during their diagnosis is important because you're often the most trusted member of the healthcare team. And especially if the person giving the screening test is of a different culture or speaks a different language than the patient, you may be a very helpful link in that setting. Well, it's not important for you to know the details of all the screening tests listed here. It might be helpful to recognize their names. So some of the screening tests that might be used by a healthcare provider include the Beck Depression Inventory, or BDI, the Hamilton Rating Scale for Depression, which is also called HAM-D or HRSD, or the Patient Health Questionnaire 9, or PHQ-9. As a community health worker, you might also be trained to administer pre-screening tests, such as the PHQ-2, or Screening, Brief Intervention, and Referral to Treatment, called SBIRT. SBIRT's a screening tool for high-risk substance use, and so that might help identify presence of a companion issue that may put a patient at higher risk of depression. So ultimately, healthcare providers will use something called the Diagnostic and Statistical Manual of Mental Disorders, or the DSM-5, to classify what type of depression someone has. So that's why a specific diagnosis is very important. Treatment for depression is challenging, but can be very successful. It can involve many different methods, and some of these can occur at the same time. So medication is one tool to treat depression, and there are a variety of drugs that may be used. These could include antidepressants, anti-anxiety medications, mood stabilizers, or antipsychotic medications. And then medication might also be used indirectly by treating other conditions that might be contributing to depression, such as diabetes. You may have heard of some of the most commonly prescribed medications to treat depression, such as MAOIs and SSRIs. Most of these meds work by acting on the brain chemicals or neurotransmitters discussed earlier in that slide with the pictures of the brain. Keep in mind that these drugs might also cause side effects in some patients, so informing doctors and encouraging your clients to inform their doctors of other drug use, whether prescription for a different condition or illicit drug use as well. That's important to result in an effective treatment plan, and also to try to avoid unnecessary side effects and interactions. As a community health worker, being aware of potential obstacles to treatment, such as other drugs that the patient's using, or awareness of side effects that are occurring due to a drug prescribed to treat depression, and helping to communicate that to the healthcare team can be an important role that you play. So psychotherapy or talk therapy is another way of treating depression, and that may be used instead of or in combination with medication. Community health workers can help their clients to identify things that they may wish to bring up during talk therapy when they go to those appointments with the counselors or therapists. Perhaps the place where the community health worker plays the biggest role in treatment for depression is through environmental supports. Environmental supports involves things like self-care, ensuring appropriate nutrition, exercise, sleep, stress management, things like that. Some individuals might find things like meditation or prayer helpful in self-care. And then as a community health worker, you might also be able to find or even start some social supports, such as a local or neighborhood exercise class, something like a walk with a doc program. And a lot of these are actually multidisciplinary. So if you have, for instance, a patient or multiple patients struggling with both depression and obesity, something like a walk with a doc program might be helpful for a lot of different people. And then supporting your clients by going with them the first time they decide to participate can also be helpful. And then I wanted to mention alternative care. There are some other treatment methods like light therapy, pet therapy, acupuncture, things like that, that can be part of a successful treatment for depression. And so you as a community health worker might be best positioned within the healthcare team to link clients with depression with some of these treatments to explore. So clearly, depression can be very difficult to understand, diagnose, and treat. Despite these obstacles, it's really important to encourage your patients, clients, and community members to seek care if they may have or have been diagnosed with depression. The impacts of depression in communities across the nation is staggering, as you can see from the graphic here. Depression causes a reduced lifespan, lost productivity in workdays, and an increased risk of suicide. 1 in 5 adults have a mental health condition. Rates of youth depression have also increased. Access to treatment's a major problem, and many people are left with no treatment or a treatment that's not good enough. In fact, over half of American adults with a mental illness did not receive treatment in recent years. There's a serious mental health workforce shortage. Another factor is that imprisonment and access to mental health care are also closely related. So based on all these statistics and in this graphic that you see here, it's obvious that everywhere in the nation, depression has a significant impact, and primary care providers and U.S. community health workers can help people struggling with this condition. Closer to home, the impacts of depression are also significant. A person with depression also greatly affects the health and wellness of their entire family and sometimes their community. For example, a single mother who has depression may be unable to take care of her young children. And at a minimum, the relationship dynamics within a family are affected, and there might be a lot of stress or tension. As a community health worker who is identifying or working with someone with depression, you might want to reach out to family members as well, because you play an important role in supporting other family members who are dealing with depression and connecting either the people with depression or those who are caregivers or affected by the individual with depression, connecting them with resources. If you're working with a person who has been diagnosed with depression, it's important to recognize that there are many potential barriers to overcoming this. As with any health condition, medication compliance is critical, and this can be especially important in depression because drugs prescribed to treat depression often require several weeks to work, and it can be really hard to stick with keeping these drugs on a regular schedule during that time, especially if the patient's experiencing side effects. It's also frustrating at times because it may take several tries with different medications before the doctors find one that works. So, a hurdle could be the frustration and discouragement to the patient from that. Access to care, as I'd mentioned earlier, and overcoming those social determinants of health is another possible barrier to treatment. Things like transportation, finances, and limited ability to control some of those negative influences in a client's environment can all play a role. Depression also has a negative stigma in many cultures, and working within and overcoming the stigma can discourage people from seeking or sticking with treatment for depression, or even acknowledging that they may have it. I did also want to mention that sometimes you or other healthcare providers might be uncomfortable working with clients with behavioral health diagnoses, such as depression. Some common thoughts are that people might not be motivated to change, so kind of why bother? And healthcare workers might also feel afraid that the person may be suicidal or may act out. So I want you to remember that it's normal to feel nervous when dealing with patients with depression, but remember that many patients are very normal people who are simply struggling with how to cope with their depression. Depression is especially difficult to overcome because it can be self-defeating, and we kind of talked about that with that maladaptive cycle of shutdown. For example, while exercise improves mood, getting someone who is depressed to exercise can really be an enormous challenge. Relapses are also common, and overcoming that behavioral shutdown can be very difficult. Depression is unique because, unlike many other health conditions, the goal is not cure, but rather finding the right combination of treatments that will result in as great of a decrease in symptoms as possible. Community health workers are really important in identifying and acknowledging these barriers and supporting their patients and clients through them. One key point is restoring the will to seek help, especially as when symptoms recur and change, when relapses occur, to just kind of support your clients and restore their will to continue with treatment. As a community health worker, maintaining contact with the patient's behavioral health provider or primary care provider is really important. You are also often the most effective person on the healthcare team in building trust. And as the one member of the healthcare team with the closest bond usually to the individual, you really play a critical role in helping the patient to hang in there when seeking and sticking with treatment. So now that you have a basic understanding of depression, how can you make a difference in your community? You may wish to go into your community and identify providers that can help patients that may have depression. So this might be a primary care provider that can administer one of those screening tests we talked about, a social worker who's accepting new patients for talk therapy, or even resources like school counselors who can help teens talk through their emotions. Having a good understanding of insurance coverage for depression, especially Medicaid and Medicare, can also be really helpful for clients because overcoming or understanding these programs can be really confusing. Knowing transportation options in your community, such as bus schedules and fees, especially to the locations like the primary care providers or therapist's office, can be a helpful tool for clients who are trying to seek help but having difficulty getting there. You might be able to help take your clients to their mental health care appointments or maybe take them to the pharmacy to pick up their medication. Researching or organizing self-care strategies such as group walks, meditation sessions, or peer-to-peer support programs is also a role that the community health worker is uniquely positioned to fill. There may also be existing organizations and programs at high schools, community colleges, universities, social services organizations, health organizations, religious organizations, or nonprofits, places like that that you can link your clients to. The World Health Organization is one online resource that has videos and other resources that might be helpful. For example, they have a video called I Had a Black Dog, His Name Was Depression, and there's a screenshot of that video on the screen here. And that's a relatable and really informative resource that I encourage you to look up and maybe use with your clients. Finally, awareness of tools for immediate support, such as the National Suicide Prevention Lifeline shown here, can make a life or death difference literally for some people with depression. At this time, I'd like to take a minute to share a real-life story of a community health worker. This example is from Maryland, and they're making a difference in their community. So I'd like to read their testimonial from one individual in the John Hopkins Community Partnership, also called JCHIP. Today, I saw the power of JCHIP unfold. It is all too often that this great work and service to our members seems to become mundane, but I would like to highlight a brief narrative on teamwork, member safety, and intervention. A member was enrolled in JCHIP through the original screening process and was contacted by our nurse care manager and community health workers. She has been engaged in JCHIP services for almost 2 years now, and in times of crisis has sought out clinical intervention from the health behavior specialist team. She has formed an ongoing working relationship with our community health worker and a trusting therapeutic relationship with her health behavior specialist. Recently, this patient, already diagnosed with depression, began to experience severe distress. She called her community health worker, stated that she couldn't do it anymore, and asked for help and support. Her community health worker headed straight to her house at 7:30 a.m. just after the telephone call. Her CHW sat with her, listened to her, and offered her services. When the patient said she had thought about hurting herself, her CHW called the health behavior specialist. The health behavior specialist was able to speak to the patient and engage her in a safety assessment over the phone. It was apparent from the assessment that this patient needed a higher level of care. So while the CHW sat with the patient and assisted her in making plans for her children, the health behavior specialist was able to arrange further evaluation and inpatient therapeutic services to keep the patient and her family safe. The health behavior specialist was able to walk the patient through the process and answer her care questions. Also able to coordinate and update the primary care physician throughout the process and team with the nurse care manager to manage all other medical care services. The patient was evaluated and admitted and is receiving the care she needs without multiple emergency room visits or long waits. It truly was the meticulous and timely teamwork of the JCHIP team that was able to step outside the traditional realm of patient care to meet the needs of our patient. And really, that's what we do every day. So given your important role as a community health worker, think back on the scenario and how it might have been different without the community health worker. As such a trusted, important member of the healthcare team to the individuals you work with every day, you really can make a significant difference in these people's lives. This example is a little farther from home. It's a story from Zimbabwe, but I'd like to share this one. It's really a story of someone just like you and me, just extending a helping hand and making a big difference in their community. Okay, so sometimes your role in working with people with depression is simply what you saw in the video here, to offer non-judgmental listening, helping them to feel worthy, and help them to set goals that are realistic and attainable. So for a bit of review, I hope that you can now explain, after tuning into this webinar, what depression is and what it is not, including its symptoms, causes, and common comorbidities, and how it's diagnosed and by whom. You should be able to describe the impact of depression, the importance of understanding depression, and be able to extrapolate the impact on your community and patients or clients and their families. And then finally, identify barriers to treatment of depression and tools to overcome these barriers. So remember, you can play a really important role in the life of a person with depression. You can give your clients a voice by helping them describe their symptoms to a provider. You can help ensure that they keep appointments with providers and community support activities. And you can help them keep their commitments relating to these self-care activities. You can be there to listen in a non-judgmental way, and you can reach out to family systems to better understand the dynamics that may influence the depression or increase risk for others in the family to suffer the same. So while these are just examples, there's some important ways to keep in mind that you can engage with your patient as a part of their healthcare team. So thank you all for tuning in, and I would be happy to take any questions at this time.
And as a reminder, you can use the chat function or the Q&A function to ask questions. We do have one that came in that says, depression is a sensitive topic. Can you touch on balancing helping with patient confidentiality?
Yeah, confidentiality, that's a good question. So maintaining confidentiality is really important to maintaining that trust that you have as a community health worker. Just because you're such a critical link between the individual and the rest of the healthcare team. For those of you working under an organization, it's important to follow your confidentiality rules that your organization might have. It might be good to address this with your supervisor in advance of being possibly faced with a difficult situation in which you're not sure how to respond. And then there are also state and federal confidentiality laws for healthcare workers that you might need to follow. But the major exception to maintaining confidentiality is if disclosure is necessary to prevent serious, foreseeable, and imminent risk of harm to self or others. So in those cases, you might need to break confidentiality by contacting an appropriate person, and it's kind of what you disclose and to whom is kind of situation dependent. So you might not have a lot of guidance other than using your professional judgment, but it is really important to maintain that trust, but of course looking out for risk of harm to self or others, in which case disclosure may be necessary. Good question.
You mentioned alternative treatments. Who would you recommend those treatments, like physicians? That's what the question says.
So I think the question might be like, who would maybe decide if an alternative treatment would be good for a certain patient. So that's sort of something you probably will have to weigh again on a case-by-case basis. Some healthcare providers are very open to alternative treatments, and others might not be. So kind of knowing what's available in your community and figuring out if a referral is needed from a primary care physician, you know, it can't hurt to bring it up from the primary care physician, and that's always kind of a good place to start as a general benchmark. But it can vary. Sometimes your client may approach those resources directly and kind of get a consultation directly from those alternative support providers.
Yep, and sorry about that. Do you know of any specific resources within Iowa that CHWs can use to help their clients with depression?
Yeah, so there are a lot of general resources that actually are applicable to both our Iowa audience and beyond. There's usually looking at the Department of Human Services and the Department of Public Health. I know in Iowa, the program through the Department of Public Health, there's a program called Your Life Iowa, and they can assist with mental illness concerns, including resources for depression. Your universities may have programs. I know that the University of Iowa has a program called the Iowa Consortium for Mental Health, so that's one example. And then there's an organization called the National Alliance on Mental Illness, or NAMI, and they have chapters nationwide and even divided out into the specific city level. Sometimes universities have chapters, or individual cities or regions. And then reaching out to like Boys and Girls Clubs or YMCA, you know, mental health and aging groups, looking at those specific group targets like children, addicts, elderly, postpartum, people that may be at higher risk. If there's a group specifically targeted towards that group, they may also have mental health resources.
Great, and we had a question about information on holistic options for depression therapy instead of manufactured medicine. Do you have any information on that?
That would kind of fall, I think, a little bit under the alternative care as well. Really holistic, I think, sometimes is a little bit of a misnomer, because we really do want to take a holistic approach, as I outlined here, with those environmental supports, social supports, the self-care mechanisms. Those are all really important in treatment of depression, and they may be supplemented by talk therapy. That's, you know, generally a really good treatment approach, and sometimes medication can really help, but not in all cases. So really that's so individual specific, and, you know, it kind of depends on their comfort level, their other risk factors, if they're taking other medications, things like that. I guess I don't have specific holistic resources to point them towards other than just kind of taking the big picture approach like we talked about in this presentation, and working with that primary care provider to see which specific resources they would recommend for that individual from, whether it be a psychiatrist that can prescribe medication or other individuals that can help with the other aspects of that holistic care plan.
We also had some questions about pre-screening clients. Do you have any information on pre-screening clients as a CHW?
Yeah, so that, let me try to find that slide back here. So a lot of those, oh, there we go. Screening tests up here at the top of the screen are what your primary care provider might give, but these pre-screening tests, the Patient Health Questionnaire 2 or the ESPERT, remember that one's kind of for substance abuse, but can help identify depression as kind of a co-occurring condition. So you may look to kind of your organization, and Deb, I don't know if you can speak any more on this also, but those are tools that a community health worker might utilize directly.
Yeah, this is Deb. Can you guys hear me?
You're a little quiet, but I can hear you.
Yeah, I would just say I am fairly certain that there are community health workers that do pre-screenings. You know, when you're using an evidence-based tool, the person conducting the screening doesn't necessarily have to be a certain level of education. So I can't give you a specific example, but I would be really surprised if there weren't some community health workers doing that kind of work.
Okay, thank you.
Thanks. We have another question. This one is asking about funding for mental health resources. So the undocumented population in Washington struggles to afford mental health costs for visits and prescriptions, as many are unable to be insured. Are there any local resources in Iowa that are used to fill the gap? They're hoping to find creative ways to help fund these individuals locally.
Yeah, that's a really good question. I guess I am not intimately familiar with how these resources are funded in Iowa. I think probably reaching out to some of those groups like the state-funded programs might be a good place to start. And kind of, if medication is unattainable for a period of time until something works out, at least launching in on those self-care until something can be figured out for the meds might be what I recommend.
And this is Deb. I can add a couple of thoughts to that. So, there are federally qualified health centers in every state that operate, on a sliding fee scale. And so they, most of them have access to, steeply discounted prescriptions, drugs. And then secondly, in Iowa, we have an organization called SafeNetRx, which is a statewide donated drug repository. And so I don't know if they exist in every state. I will say Iowa has a phenomenal one. And I think it's the largest in the country, actually. But they have been able to partner and provide some prescriptions, for example, for people with mental health issues that are leaving the correction system or local jails. They have been really kind of creative in partnering with organizations around mental health prescriptions at no cost. So check out to see if your state has a donated drug repository.
And we did get in the chat box from Jennifer Walters saying that Catholic Charities, Broadlawns, and county mental health community services can help as well. The last question I think we have time for would be, during your presentation, good nutrition was implied. Would a nutritionist ever be part of the healthcare team?
Yeah, that's a great question. I definitely think bringing on a nutritionist would be a good plan. especially if you've identified that in your patient as something that could use improvement. So yeah, there are definitely additional healthcare team members that I didn't list on my slide that, you know, could really help with people with depression, you know, people like even physical therapists or, you know, exercise trainers, things like that. All of that could definitely help. Great point.
Great, and that's all the questions that we have. So I was going to hand things off to Deb to close off.
Okay, thanks. And sorry you all can't hear me very well. I'm trying to speak loudly. I'm not sure what's up, but anyway, it's been our pleasure to offer this webinar series, and we are thrilled to have so many participants from other states. I hope everyone feels like they have a better understanding of depression and picked up some good nuggets of information today. I want to thank Dr. Lee for researching and pulling together this excellent presentation. And again, thank our colleagues at the Midwestern Public Health Training Center for their partnership. And finally, thanks to all of you for participating today, but more importantly, for the important work that you do. As Kate mentioned at the onset of this webinar, you'll receive the link to the recording in a week or so. And I guess that's a wrap. Everyone have a great day, and thanks again.
Thank you.
Thank you.